All right, again, hello and welcome to ACNJ's latest Lunch and Learn series. Today, we are joined by Juleen Johnson, a maternal child health registered nurse, an international board certified lactation consultant with over 18 years of experience supporting families across clinical, community, and leadership settings. She currently serves as the Director of Clinical Operations at the Perinatal Health Equity Initiative, who's a great partner of ours and brings both professional expertise and lived experience as a mother herself to today's conversation. So please, everyone, join me in welcoming Juleen.
Hello, everyone. Thank you so much for joining us for today's Lunch and Learn. I'm happy to be here to discuss this really important topic, and I'm looking forward to it. I'm going to put myself off camera so that this can be a smooth, unbuffered experience for you, and I look forward to the questions that you have at the end. All right, we are going to be talking about childhood immunizations and urgent care access, how we keep our kids healthy and how we keep our kids safe. So we're going to talk about the dynamic, the powerful immune system, its role in our daily lives, some key concepts about immunity, including how our bodies make antibodies and how we get protected from illness. The simple things we can do to prevent illness from occurring in the first place, and then how vaccines play a role in illness prevention. We're going to talk about the CDC vaccine schedule, recommendations during pregnancy and childhood, and then we're also going to take a look at just some specific vaccines. We're going to talk a little bit about the Vaccines for Children program, access to vaccinations, and then really important, the difference between primary care, emergent care, urgent care, and then under what circumstances you would utilize these levels of care. Okay, so we're taking it back to school for just a little bit. What is the role of our immune system? So I want you to think about the fact that our immune system is one of the hardest working and most coordinated systems in our bodies. It's a group of things. It's organs, it's cells, it's chemicals, it's proteins. It's like a tall building, a castle. It's also a crew of armed security guards, it's MMA fighters, it's sanitation workers, and it's also a library and an encyclopedia. It's doing all of those things at the same time. It's helping to prevent germs and diseases from entering the body in the first place so that you don't get sick. And then if you do get sick, it is your warrior. It's fighting those bugs and it's helping you heal. I think the best part about all of this is it then remembers those bugs so that that specific bug won't harm you in the same way in the future. That good memory, that antibody system is really important. So some other key concepts, that wonderful memory, that those antibodies, those are proteins produced by your body to destroy the germs and those toxins. But what's important to remember about antibodies is that they are disease specific. So it's not just one general antibody. You get very specific ones. And so we become immune to a specific disease when our bodies create the antibodies to that specific thing. So for example, right, you something like chickenpox, once you create antibodies to it, that's it. That's all you'll ever need. But the flu, it's a bit different. It changes often. That's a virus that changes all the time. So you can have immunity to this year's version, but you'll still need a shot for the next year because next year's will be a bit different. And so that's one of the reasons why for some diseases, you'll just need like a one and done, or you'll just get sick that one time and you're okay. But for others, you might need annual immunity. Um, there are two types of immunity, active, passive. Let's talk about that a little bit. So passive immunity is like a gift. It's a very nice gift. You receive the antibodies instead of having to make them on your own. So this is actually one of the primary ways we've kept our babies safe for generations, right? Maternal antibodies are a great example of that. We pass this passive immunity along via the placenta during your pregnancy, and then after we give birth, we continue to protect our babies by passing down the antibodies in our breast milk. And just lactation consultant and me, the quick plug here. This is one of the most important benefits of breastfeeding, right? I mean, there are many, many benefits of breastfeeding. It sets our kids up for a healthier life. The antibodies gets passed along. It just lowers the risk of most things, but specifically your gut and respiratory infections. You have a lowered risk of diabetes, asthma, obesity, certain cancers. The list is really long. So we are starting them off on a really, really good and healthy path. Um, And so for that reason, it's recommended that we give our babies nothing but breast milk for the first 6 months of their lives. And then we continue giving breast milk for about 2 years, longer if you choose to, while you're introducing solids. Again, there's lots of benefits for baby, but there's also lots of benefits for you as the mother who's breastfeeding. Some of those include lowered risk of breast cancers, ovarian cancers, heart disease, type 2 diabetes. I mean, the list goes on. Um, so that's one way that you can transfer passive immunity, but we can also do it through injections. So I want you to think about a poisonous snake bite. That's pretty scary. Snake venom is pretty lethal, but you can get passive immunity for snake venom through an injection, antivenom, right? It's basically pre-made antibodies from immunized animals, like a horse who was exposed, and you kind of get that. It neutralizes the toxins immediately. Passive immunity is really quick. It works really quickly, but the thing about passive immunity, it's only short term. So it works really well, really quickly, really, really quickly, but it goes away. So in another example, with a mother with hepatitis B, or if you are a healthcare worker and you get, a needle stick or something like that, and you're at risk for hepatitis B, the vaccine isn't enough. You want to also get this hepatitis B immune globulin. That can give you that passive immunity. It works really, really quickly. HBIG, as we call it. It has high levels of hepatitis B antibodies from donors. And then this immediately neutralizes the virus, and it gives now your body time for the vaccine to start working on that more active immunity. So, this is why even after you're getting those antibodies from mom during pregnancy or through breastfeeding, our kids have to start getting their own vaccines because the passive immunity, while it's great, it's short term, and they have to start building that active immunity. And that's what we're going to talk about next. So, active immunity, this is what's created by our own immune system when we're either exposed to an illness or an infection or get a vaccine. So what this is, the body produces the antibodies to that specific disease from that exposure. Now, this one's the good one because it lasts a really long time. And in some cases, it can be lifelong. It's a one and done in many cases. And so you can definitely get active immunity from getting sick or from, dangerous exposure, but vaccines are a really safe and controlled way of creating this immunity, right? So for example, it's a lot safer to become immune to measles by getting the measles vaccine versus actually getting full-blown measles. So while that natural immunity is great, because again, active immunity, we want that. We want that lifelong protection against something. The vaccine-induced immunity is a safer way in many cases for those really dangerous infections. And there's also this concept in public health called herd immunity. It's an interesting public health concept, and it's actually one of the ways we keep our communities and our societies, those outside of our homes, safe. Because when enough people around us are exposed to something and start to develop immunity, it's not that easy to spread anymore. And as more people become immune, there are a few people around to infect. Like the host, the germs are looking for places to go, and it's like, where do I go? So for those babies who are still in that period of time where they can't get vaccines yet, they're still relying on that temporary passive immunity. And as we said before, it's really strong. It works really well, but it's a very short-term thing. So it's important that they start getting that active immunity. But in that window when they haven't started that yet, they're really susceptible. Or for the elderly or the immunocompromised or folks who just really aren't able to protect themselves and they're more prone to getting sick, as a society, we can help them by ensuring we are immune. And so we don't pass things along to them. A lot of times, especially around this conversation, we can sometimes think very selfishly, and we don't always think about how our decisions impact the health and, frankly, the lives of others. There's more to this though, because this type of immunity depends on the type of the disease, how it's spread. It doesn't work for the same illness or exposure in the same way every time. But the concept here is as we just discussed. So before we jump any further, really, really, really important, we can't skimp on this part. As the old saying goes, prevention is better than cure, right? And there are just some things that we can do just off the bat to prevent illness from occurring. The best way to prevent an illness or disease is to prevent it from happening in the first place. I think the most important thing on this slide is proper hand washing. We cannot skimp on this enough. It is a life-saving skill. We need to teach it to our kids. early. And not just like run the water and splash your hands under it. That's fun, but we have to teach them, sing the songs with them. It doesn't have to be the happy birthday song, it can be your favorite song at home. Wash your hands, rub it vigorously, rub both sides of your hands. Practice it at home, make it a fun experience, provide prizes, like make hand washing a thing in your houses or your homes. It should be cultural, it should be wonderful, it should be something ingrained in our children from early because it is one of the best ways to prevent illness. Hand sanitizers are great too. It's a quick thing that we can use to kill bugs, but if your hand is visibly soiled, you need to wash them. Um, Germs, they love to enter our bodies through your eyes, your nose, your mouth. And if you have dirty hands, it makes it worse. Um, because there it goes. You're bringing your dirty hands to the places that germs love to enter through anyway. And this is what gets our kids sick because kids are very, very handsy and they like to put their hands in their mouths, in their face. They like to put their hands in their friends' faces, their family's faces. If there's a thing, they're touching it, their toys. And so you can understand why kids so easily get sick because of the hands and the lack of hand washing and their touchiness. So we want to keep that in mind. In terms of illness prevention, think about how most germs are conveyed. They're conveyed via coughing, sneezing, or droplets. So proper cough hygiene is important too. So you're coughing into the crook of your elbow, not into your hands, because again, once on your hands, it's likely going to go on your face and so forth and so on. We don't think about this one all the time, but especially for the older folks, don't go to work if you're sick, but for your kids too. They should stay home if they're sick. If they have a fever, which sometimes indicates that either something's brewing or was brewing, or maybe on the tail end, we're not really sure, but you can be contagious. And it's just, they're kids, they're going to be in each other's faces. You're going to get someone else sick, so they should stay home if they're sick. The other way that we can get sick is from our food. Okay, and how it's prepared. So raw foods on our surfaces, undercooked foods, parasites in the foods. Um, Clean your areas as you're cooking. Be mindful of what you're putting in your body. Clean, disinfect the spaces around you. Germs live on these spaces, so kind of keep that in mind. It's not just on your hands when you touch things, they live on the surfaces too. So clean and disinfect your surfaces. Strengthen your immune system. This one is a really major one. Strengthen your immune system. Your immune system is working so hard. We mentioned before, it's a really coordinated system. It's a very hardworking system, but you really should strengthen it. And you want to start early. So again, back to breastfeeding, right? We start them off in that healthy way by providing breast milk. And then as they grow, we offer a nutritious diet to continue to strengthen their immune system and just enable proper growth and development, right? And just in general, eating a balanced diet, lots of fruits and veggies, managing your stress. We don't talk enough about how stress just weakens just your mental health, but also your immune system. Getting enough sleep. Our babies, our kids, they need sleep, 10 plus hours, okay? Let them sleep. Sleep is really important for building and maintaining our immune system. Hydration, drinking your water, exercising, movement. All of these things are just important ways of keeping our immune systems intact. And of course, getting vaccinated, because this is how we can prevent many illnesses without actually having to get sick. All right, let's talk about the role of vaccines. So we said before, they're a great way to develop active immunity to a disease, and we don't have to get sick to do it. They're just much safer than getting sick. It's safer to have your kids be immune to measles than them getting sick from measles. So they protect you. They protect those around you. They protect those who can't be vaccinated just yet, like our small babies, the immunocompromised, those who just really don't have the immune system that works very well in our society. And so from a public health standpoint, that's why in group settings, like our schools, they are required. So there's a vaccine schedule that the CDC has shared and recommendations for when everyone should get vaccinated. It's important that we not only get vaccinated, but that we get vaccinated on the recommended schedule and at the recommended time. So think about it this way, right? If we're delaying it too much and our kids are allowed into schools together and half of the kids are on schedule and half are not, I mean, they're kids. They're going to be playing with each other, touching, maybe not washing their hands as well. And there may be kids around who are immunocompromised because of other things going on with them in terms of their health. We can really be harming our friends in that way. And I want you to think of it that way. The decisions that we make as a family, are important for your family, but they're important for the rest of us as well. You can be harming your friends. Those decisions can be harmful. All right. So let's talk about the types of vaccines really quickly. Not going to spend too long on this. I just want you to have some info on the language and the different types of vaccines that are out there. So inactivated ones, what does that mean? It means they're using a basically killed version of the germ. It's not live, it's not living around and moving around. It's a killed version of the germ. So because of that, it's not as strong. And you're likely going to need multiple doses or boosters. So this is like our annual flu shot. It's not using the flu. It's using a killed version of that germ. And then there's the live one, the live attenuated one. It's using a weaker form of the germ. So it is the germ, but it's a weaker form. And so because of that, it's a very similar thing to the natural infection. And because it's a similar thing to the natural infection, your body creates a really strong and a really long-lasting active immunity. So an example of this one is measles, right? The MMR, the measles, mumps, rubella vaccine. Measles is very contagious, by the way. It's going to be spread through coughing, through sneezing, and that's why kids, they get it very, very easily if it's exposed. But it can be really life-threatening. It's just really unfortunate to see like lives being lost when there's an available vaccine that is a strong one that can offer potential long-lasting or even lifelong immunity. The others listed here, they do similar things. They create an immune response or provide immunity specifically for the germ or for that exposure, specific immunity. All right. So we're going to go through the different recommendations. We're going to go from pregnancy to childhood. So, vaccine recommendations in pregnancy. It is important that you review your records before pregnancy. So, if you're planning on starting a family, um, get your records together. Why is that important? So, for example, rubella, right? It's actually very dangerous if you get rubella in your pregnancy. It can cause miscarriage. It can lead to birth defects. So this is one of those things you want to protect against. You don't want to get this one while you're pregnant. So look through your records. If you recognize, actually, I am not immune to rubella or to measles, you should get that like a month, at least a month before you plan to get pregnant. Get yourself as protected as possible before a pregnancy. During the pregnancy, now we're thinking, I have to protect myself because I don't want to get sick during this pregnancy for sure, but I don't want to get this baby sick. But more importantly, how can I protect this baby? We talked before about passive immunity. This is one of the best ways to start our babies off. They don't start getting their own active immunity for months. So, how do I get them protected while I can? And you're the best route for that. So, during pregnancy, there are some recommendations, one being the Tdap vaccine. This one is protective of whooping cough. Whooping cough is very dangerous for our babies. So the Tdap vaccine, we usually recommend, it is usually recommended between weeks 27 and 36 of pregnancy, and you should get it every pregnancy for that reason, to give that baby that passive immunity. Um, Pregnant women can also protect themselves and babies from all the respiratory bugs out there, especially this time of year. It's the yucky respiratory season. So COVID, flu, RSV are recommended for that reason. So RSV either weeks 32 to 36 of pregnancy, but it's specific to the time of the year. So September through January. That'll protect your baby through their first RSV season. So the baby doesn't have to get it at birth if during your pregnancy, during that time, that specific window of time, it was received, which is wonderful. And if not, the baby can get that during after birth. So let's now talk through the recommendations and the schedule that the CDC recommends for our children. Um, and this is really well laid out. I think the CDC site is a really great place for clearly outlining what our schedule is, what it should be in a really nice visual. So just, your RSV, as we just talked about, hepatitis, there have been some changes to that. We'll talk about that in a second. Um, the hepatitis B is a 3-dose series at birth, and then 2 doses after that. And then all the ones listed here, rotavirus, DTaP, HIV, pneumococcal, polio, and the recommendations for COVID, flu, and then your MMR, your measles, mumps, rubella. And we went through before the different types, which ones are live, attenuated versus which ones are actually a killed version. And then we said before, from a public health standpoint, there are recommendations, and then there are what we really need to be doing so that we can bring our children all into one place together safely. And so for that reason, there are recommendations or requirements, I should say, for your children to be vaccinated before they can attend school. So the same ones that were listed before, but this is just showing you at what point they need to have it by. And the same for beyond the preschool life. We're talking kindergarten through sixth grade and higher. And you can find all of this information either on the CDC site or in your state's website. But the concept here is we're thinking global health, we're thinking public health. We're bringing our children into a communal space. We need to ensure that they are protected and that we protect ourselves. The Vaccines for Children program. It's a federally funded program. Free vaccines are provided for our children. If something is recommended or required for public health, ways of paying for it shouldn't be a reason to not get it. So within this program, under 18, eligible for Medicaid, uninsured or underinsured, or American Indian or Alaska Native. If this is, if you fall within this category, you are able to get your vaccines for free. What you want to consider, though, is the CDC advisory panel recently changed the recommendation for the hepatitis B birth dose, um, stating that if it's not given at birth, it should be given no earlier than 2 months. So before it was the birth dose and then two subsequent doses. So there's a lot of thoughts on this, but one concern is how this is going to impact payment because these programs, like the Vaccine for Children's program, they ensure that we have free vaccines based on that CDC schedule. So it may impact that because if it's not recommended or on the schedule, payment may not later on be free for parents who desire that birth dose. So just want to quickly go through primary care versus emergency care versus urgent care, when you would use one of these three, where can you get vaccines if needed? So primary care, this is your regular provider for checkups. This is where you go for wellness checks, preventative care. This is likely where you're going to be getting, for yourself and for your children, their vaccines, their routine pediatric provider, your internist. And this is, again, following the concept that prevention is better than cure, right? So you should be at least getting your annuals. You should be getting your vaccines. This is someone that you have a relationship with or a practice that you have a relationship with. You're going to frequently, not just in sickness, but to prevent that. In between, if something is intermediate, you're not sure if it's minor enough to wait until your scheduled primary care appointment, you want to visit an urgent care. So this is for non-life-threatening injuries. So a cough, it's an uncomfortable cough. You're not sure what it is. You're trying to get testing for what it could be. This is an urgent care visit. You're not having difficulty breathing. You are uncomfortable, but you're talking through it. If you're an adult, you're working from home on your computer with this cough. You're looking for help because your primary care visit isn't for another month and you can't sit with this for a month, but this is not emergent. Now, your urgent care centers can actually also provide vaccines, especially if it's one of those things that are impacting compliance with school requirements. Like you can't wait to get to your primary care appointment in a month if you're needing help getting your child enrolled. And this is something required. So your urgent care centers can assist you with that. Emergency rooms should not be used for things that can be done in your primary care centers or your urgent care centers. We want to leave the emergency room and emergency services for emergencies so that the folks working there or going there can get the care that they need. So this is for your severe life-threatening condition. So this can sometimes be confusing because I know as a mom myself, something feels like an emergency when it comes to your kids. It always feels like it has to be taken care of right away. We were wanting to think, is this impacting breathing? Is this impacting well-being? If I don't handle this right now, what will happen? So asthma, that's a really tricky one. I don't know that asthma is urgent care versus emergency care. If this is asthma, if this is an attack, if this is something occurring with breathing, this is an emergency. That's how you want to filter it. If this is affecting breathing, if there's bleeding, if this can really become something that's an infection, I need to take care of it now. This is emergency care. I also want to point out that your vaccines can be obtained at pharmacies, your health departments, hospitals. Um, Primary care, again, is your first route. You can obtain your vaccines at urgent cares, pharmacies, health departments, hospitals. You want to leave those things out of the emergency room. I'm going to end by saying that vaccines save lives. There are many statements, comments, thoughts, feelings about vaccines, but the evidence is clear, the science is clear. Vaccines save lives, and prevention is better than cure. It is a lot easier to not get sick or safely introduce vaccines, as opposed to getting exposure to the illness itself.